Hey mamas, C-sections are one of the most common surgical procedures done in the United States. In fact, between 1997 and 2010, it was the most common major operating room procedure. And although the cesarean section rate has gone down a little bit since then, we haven't actually seen a dramatic change. And one of the biggest reasons for first-time mamas getting a C-section is due to what's called failure to progress. So in this video, we are going to talk about what failure to progress means in labor, how to know it's actually happening in your labor, and how to prevent and remedy it so that you can avoid an unnecessary C-section. I'm Bridget, and I'm a childbirth educator and a birth doula in the San Francisco Bay Area, and I love helping mamas just like you really believe that they are built to birth their babies. If you're new here and haven't yet, make sure you subscribe to this channel and hit the little bell so you don't miss any of my future videos. So what is failure to progress? To understand this, we have to learn a little bit about birth history. There was a male doctor by the name of Emanuel Friedman who in 1955 published a study that examined how long it took 500 women on average to dilate centimeter by centimeter and went on to graph those labors in what became known as Friedman's curve. Basically, his findings said that first-time mamas should give birth within about 14 hours and women who have given birth before should give birth in about 8 hours. This Friedman's curve has been used by most healthcare providers since the 1950s until very recently. Based on Friedman, failure to progress came to mean women's cervixes were not dilating at the pace they should be on average. So for first-time mamas, getting from 0 to 4 centimeters should take about 8.5 hours, and then from there should dilate to a 10 in just under 5 hours with an hour to push. New studies, specifically Zhang's study, however, is showing how inaccurate and unacceptable using Friedman's curve is. Where Friedman said that active labor began at 4 centimeters, we now describe active labor being at 6 centimeters, and we know that it can take women several hours to dilate just from 1 centimeter to the next, especially in early labor before she reaches 6 centimeters. However, despite this, we are still seeing that many C-sections that are performed because a woman's labor is considered failure to progress are happening before 6 centimeters, so while a woman is still in early labor. A study released in 2013 shared that 4 in 10 women who were first-time mothers and received a C-section due to failure to progress were taken to surgery before they had even reached 5 centimeters. And this is a huge issue that we're facing because women are not being given the time that they need to allow their body to do what it needs to do, and for a lot of first-time mamas, it does take a while for their body to open and stretch for the very first time. Failure to progress can either mean labor is taking longer than expected for the cervix to dilate from 0 to 10 centimeters, or pushing is taking longer than expected. And what's tricky is that failure to progress is a very loosely defined term, which means it varies a bit from one provider to the next and is sort of left to their discretion. Typically, labor may be considered failure to progress if after mama has reached 6 centimeters dilated, and then after 4 hours with strong surges or 6 hours of strong surges with Pitocin, there still isn't much cervical change. Or if during the pushing stage, baby still hasn't been born after 3 hours of pushing, this can also mean that your labor might be considered failure to progress. So if your care provider starts mentioning labor as failure to progress, the first thing you should think about to determine whether or not this is true for your labor is where you are in the labor process. If you are not yet 6 centimeters dilated, so not in active labor yet, your care provider can't actually reliably diagnose failure to progress because it's too early on. And in the early labor phase, dilation can be a slow process. At this point, it is definitely not a reason for a C-section unless baby or mama is showing signs of distress, and even with signs of distress, there might be better alternatives than a C-section at this point. If you are in active labor and your care provider starts talking about failure to progress, you should think about the length of time. Has it been at least 4 to 6 hours with strong surges? Because if not, some more time might help show some progress in the cervix. If you're pushing and it's been less than 3 hours, then you should be given more time and support to birth your baby vaginally. Then the next thing you should look for if you start hearing about failure to progress is whether you are progressing in other ways besides dilation. Because mama, dilation is not everything. And I talk all about the other signs of progress during labor that need to happen during the labor process in this video that I'm linking up here that you definitely need to check out if you haven't. Labor progress is not cervix-centered, so you should be assessed to see all the other ways that you're progressing in order to know if you are actually failing to progress or if you are simply slow to progress, because there is a big difference, and making that difference clear can mean having a vaginal birth or a C-section. Patience is one of the best things that you can give your baby toward the end of your pregnancy and in the birth process as well, because there's a lot that they have to do inside your body before they can be born. But patience can be difficult, especially during labor, so there are things that you can do to help move labor along and to help your body and baby work together during birth. In the early stages of labor, before a mama is 5 centimeters dilated, a stall in her labor is likely due to an emotional disturbance. And after she is 5 centimeters dilated, a stall in her labor is likely a physical issue that needs to be resolved. During labor, especially in early labor, it is so important to have an environment that supports labor progress. Your mind, body, and baby are deeply impacted by your environment that you are in while you're in labor. So creating a space where you feel safe in is going to play a big role in your progress towards birthing your baby. I talk about the 5 elements of your birth environment in this video that I'm linking up here that you should check out after this video. The other factor that plays a big role in labor progress is your mind. I've said it probably 100 times now, but where your mind leads, your body follows. So if you aren't feeling confident, safe, respected, or empowered in your birth experience, it's likely that your body is going to have a difficult time doing the work that it needs to do. That's why affirmations are so powerful during pregnancy and especially during labor. They serve as reminders that feed truth and encouragement into your mind so that they seep into your body and allow you to labor confidently. If you haven't already, you can listen to my affirmation meditations playlist on YouTube that I'm linking right up here, or you can purchase and download them on my website, builttobirth.com, that I've linked down below in the descriptions so that you can have those affirmations with you even while you're in labor. They are a great resource to help keep a positive and progressing mindset during labor. Now, when the cervix reaches 5 centimeters dilation, which means you're approaching active labor, and then there's a stall, it could be that your emotions are playing into it slightly, but it's likely a positional issue of baby inside your womb. This is why movement is so important during labor, because without it, baby faces the challenge of having limited space to move down through the pelvis and out. Movement allows your pelvis to open up. It changes the angles that your baby's head hits the bony structure of the pelvis or the soft tissue in your pelvic region, and uses gravity to help baby descend. I'm actually working on a whole online childbirth education course for you guys where I go in depth on movements to do during labor, and specifically what movements you can do when labor becomes challenging as it is during a prolonged labor. It will be releasing in the next couple of months, so if you're an expecting mama, make sure that you are keeping your eyes out for the Built to Birth e-course, or it might already be released if you are watching this video after it's released, in which case you will have access to it in the description below. But basically, whether you're in active labor or in the pushing stage, movement is key to help your baby to be born. So if your care provider begins talking about failure to progress, your first inclination should be to move and change positions, whether you're in active labor or the pushing stage, whether you are having a medicated or an unmedicated birth. Change positions, move around, and use gravity. If you haven't watched my video on using a birth ball during labor and finding positions for labor, watch this video up here where I talk about the 3 rules to go by when you're trying to find labor positions and movements. Lastly, if you're experiencing a situation where your care provider is talking to you about failure to progress and the decisions that you need to make sure you know whether or not it's an emergency. Most of the time, it's not actually an emergency as much as it's simply the fact that labor is not moving along to the timeline that they expected it to have. If you and your baby are safe, which you likely will be, you have every right to labor without intervention as long as you would like. Now, if you're feeling exhausted and too uncomfortable, you can also ask for options to help you find rest or manage your sensations. But always remember that you have options. As you are making these decisions, don't forget to use your brain. Know the benefits, the risks, alternatives, what your intuition is saying, and what would happen if you did nothing at all for a little while longer or even indefinitely. I'll link the video up for using your brain and decision making during labor right up here for you to check out. Mama, your body was built to birth your baby and to do it so well. Sometimes C-sections are necessary, and we can be so grateful to have access to them when they are truly necessary. But C-sections, as you know from what we talked about earlier on in this video, are often used unnecessarily. I hope this video has given you an understanding of what failure to progress means and how to navigate a birth experience where that phrase might be used. Whether your baby is born vaginally or with a C-section, your body and your baby is not a failure. You are an incredible and amazingly made human being and the best mama for your baby. So thanks for being with me in this video, and I will see you in the next one.